Hello, my name is Lesli Ramirez, and I am a current McNair Scholar, and this is my poster presentation for the 2026 Undergraduate Research Symposium. My research focuses on food insecurity among rural Latinx populations in the United States. This research project was completed under the mentorship of Dr. Elizabeth Budd, who is part of the Counseling Psychology and Human Services Department here at the University of Oregon. So, to begin, you may ask, what is food insecurity? So, food insecurity is defined as limited or uncertain access to sufficient, safe, and nutritious food at the household level. It is important to note that food insecurity is not the same as hunger. It includes not only whether individuals have enough food, but also the quality, consistency, and reliability of that food over time. Food insecurity remains a major public health issue within the United States, affecting over 44 million people. It is associated with a wide range of negative outcomes, including a variety of chronic diseases such as diabetes and cardiovascular disease, weakened immune functioning, poor mental health, and developmental and academic challenges in young children. However, food insecurity does not affect all populations equally. It is shaped by broader structural and socioeconomic factors, including income stability, limited access to resources, and systemic inequalities. Certain populations are disproportionately affected, particularly rural communities and Latinx households. This brings us to the focus of my study. While there is existing research on rural food insecurity and on disparities within Latinx communities, there is still very limited research that examines the intersection of both. This gap is important because rural Latinx populations experience overlapping barriers that are often overlooked in public health research and policies. Based on this, my study really centered around four main research questions, which are what factors are associated with food insecurity? What is known about food insecurity in rural versus non rural communities? What is known about food insecurity among Latinx communities? And finally, what is known specifically about food insecurity among rural Latinx populations? To answer these questions, I conducted a narrative literature review. This approach allowed me to synthesize existing research rather than collect new data. The literature search was conducted between June and September of 2025 using Google Scholar and the University of Oregon library databases. I use keywords such as food insecurity, Latinx, rural, disparities, and United States. The initial search produced approximately 400 or so articles. I then applied inclusion criteria focusing studies that were conducted within the United States that were relevant to rural populations, Latinx communities, and food insecurity. After screening titles and abstracts, I was able to narrow down the sample down to 20 peer-reviewed studies. And from these studies, I extracted some key information, including the study design, population, geographic setting, and major findings, which allow me to identify consistent themes across the literature. And now moving on to the results. First, in terms of factors associated with food insecurity, the literature consistently identifies income instability and high living cost as primary drivers. When households do not have stable or sufficient income, it becomes very difficult to consistently be able to afford nutritious food. Additionally, limited access to affordable and healthy food options contribute to poorer diet quality. Many households rely on cheap, highly processed foods, because they are just simply more accessible and affordable. And additionally, barriers to assistance programs such as SNAP also play a significant role. These barriers can include lack of information, difficulty navigating the application processes, and eligibility restrictions. Altogether, these factors show that food insecurity is simply not about an individual's personal choice, but rather about just structural constraints. Next, when comparing rural and non rural communities, the data shows that food insecurity rates are statistically higher in rural areas at approximately 16.1% compared to 12.6% in non rural areas. One major reason for this difference in geographic access is that many rural areas are considered food deserts, meaning that there are limited grocery stores available, or as a result, residents often have to travel longer distances, sometimes over approximately 20 to 30 miles, to access affordable and nutritious foods, which, as a result of this can create some additional costs, especially related to transportation, such as gas. For low income households, these added costs can make accessing food even more difficult, simply because even if there is transportation, it is typically very far away and not a walkable distance. And in addition, rural communities often have lower average wages and more unstable employment, particularly in agricultural sectors. These economic conditions further increase the risk of food insecurity. And now, moving on to the Latinx communities, the literature shows that food insecurity rates are significantly higher compared to the national average. Approximately 17.2% of Latinx households experience food insecurity compared to about 10.5% overall. Latinx children are also disproportionately affected, with studies showing that they are about twice as likely to live in food insecure households compared to non Latinx white children. Several factors contribute to these disparities. Latinx individuals are also more likely to work in low wage or unstable jobs, which limits their ability to consistently afford food. Language barriers can also make it even more difficult to access information and services. And additionally, immigration related barriers are another critical factor. Many individuals, particularly those who are undocumented, may most likely avoid applying for assistance programs such as, for example, SNAP, due to the fear of deportation or concerns about their eligibility. Even when individuals qualify for support, these fears can often prevent them from accessing needed resources. And finally, when looking specifically at rural Latinx communities, the challenges become even more complex. The Latinx population in rural areas have grown significantly over the past several decades, yet infrastructure and support systems have not kept pace. Rural Latinx households often face long travel distances to grocery stores, limited transportation options, and reduced access to culturally appropriate foods. For example, during the COVID-19 pandemic, these communities experienced particularly high levels of food insecurity, highlighting their vulnerability during these times of crisis. Overall, rural Latinx populations have faced and continue to face a combination of geographic, economic, and systemic barriers that intersects and just compound with one another. And in conclusion, this review highlights the rural Latinx community's experience disproportionately high levels of food insecurity due to intersection structural and economic barriers. These inequalities contribute to long-term health, developmental, and socioeconomic disparities. Addressing this issue requires targeted and culturally responsive policies, as well as improved access to resources and support system. Without broader systemic change, food insecurity will continue to reinforce cycles of poverty and poor health in these communities. Thank you for your time. I'd really like to give a special thank you to the Undergraduate Research Symposium Committee and to Dr. Elizabeth Budd for her mentorship and support throughout this project. And finally, I would like to acknowledge that the printing of this poster was supported by the University of Oregon Libraries and the Linguistic School of Business. If you have any questions or would like to connect, my contact information is provided on the poster. Thank you.